When it comes to PCO, first we should understand why we should monitor them, because these PCOD patients do face problems from adolescent to menopause. So at the adolescent phase, they have menstrual irregularities, they may face obesity and overweight problems, and as they enter the reproductive part of their life, they face infertility, miscarriages, and during pregnancy also they may have gestational diabetes, pregnancy-induced hypertension, and they also face metabolic problems like hypertension, cardiovascular diseases, diabetes, and uterine cancers even earlier in life. So what we ideally do is these patients need to actually be monitored very thoroughly. So these patients, when they visit us for the first time, we actually document their BMI, that is the body mass index. We monitor their ovulation pattern. We also check their blood pressure and fasting blood sugars. These patients should also be screened for depression and anxiety. And if they get pregnant, then they could be at risk for early onset gestational diabetes. And this screening is done through a test called oral glucose tolerance test. And they could also be checked for the lipid profile, which is the cholesterol parameters, to assess their cardiovascular risk. So once these baseline parameters are documented, these PCO patients need to be followed up regularly. So the most crucial thing is that they come back for follow-up, because the values will change as their age is advancing, because the severity of PCO could manifest a little later also. So usually, depending on the baseline values, either we call them annually or at least once in 2 to 3 years. So there are recommendations and guidelines for the monitoring and the follow-up of PCO patients, which should be done not just at the later part, but they have to start the monitoring from adolescence to menopause, and sometimes it could be lifelong also.